Hi, welcome to Lunch and Learn series. And today we have Jan and Sarah from Clark County Public Health, and then the children and youth with special health care needs, talking about their focus on families. And so take it away.
Uh, Thank you everyone for coming and wanting to learn about public health. So Sarah and we will be bouncing back and forth, and we will just do a general overview of public health and some of the services that you may have heard of, and then we will focus more of our family services that we offer. I will start. So my name is Jan Schmallenberger. I've been with public health for 30 years, over 30 years now, and currently I'm in the Children and Youth with Special Health Care Needs program. And this is Sarah.
And I'm the program coordinator with some of the programs we're going to go over today, accessing baby and child dentistry and children and youth with special health care needs, and talk about some of our upcoming projects we have for this year.
So I'll upload, we have a presentation, a PowerPoint to share. So public health. We are part of the Healthy Communities and Chronic Disease Prevention Department at Clark County Public Health. Let me get this slide going. Some of the services and operations that we offer at Public Health, you probably have heard several of them and utilized them. So we do the birth and death certificates. We have environmental health, where they do the permitting and septic inspections. We have emergency preparedness, where they do a big variety of helping just plan and prepare to help the community get through all kinds of emergency preparedness, from illnesses to natural disasters like our flooding, or the big one like volcanoes and earthquakes. We have infectious and communicable disease prevention, who monitors ongoing infections in our community, and when there's an uptick or a leveling, and kind of helps with our health officer and director, Dr. Ellen Melnick. They come up with a plan to help to minimize some and mitigate serious diseases and infections. Healthy communities, chronic disease prevention, that's Sarah and I, and healthy families. Public health is governed, not a lot of people know how public health makes their decisions and what we are going to focus on. So public health is governed by the Board of Health, which is comprised of our Clark County Council members. Our leaders attend their meetings regularly and go over our grants and projects, along with some trends that they're seeing in the community. And this gives the board members opportunity to ask questions and set fee schedules to help maintain our programs. Today, though, we will be focusing on these last two services: healthy communities, chronic disease prevention, and healthy families.
Okay. So we have one of our big programs. So little thing about public health is we love our acronyms. I think every department has its own little fun acronym. So accessing baby and child dentistry, ABCD, children and youth with special health care needs, which is everybody's favorite acronym, pronounced Chishkin, which is a fun one. And then the very simple NFP, which is Nurse Family Partnership. So you'll hear a lot of these different names referred to all the times, and don't ever be afraid to say, hey, what does that stand for? Hey, what does that mean? I think we do this in our own meetings with our own, you should hear our meetings. They're a bunch of acronyms. And so one of our big programs we have is Accessing Baby and Child Dentistry. And what it is from children from birth to 6 with Washington Apple Health Medicaid insurance, and for children 0 to 12 with Washington Medicaid DDA, connecting them to a dentist. The big thing is trying to get preventive help versus like letting them wait till they're in severe pain and then it has to be a surgery. The exciting thing we did this year was Jan, with our Chishkin special needs program, partnered with our ABCD program, and we created the flyer on the previous slide about helping children with special needs go to the dentist. And we really try to create this flyer that made them think of how to start this process weeks before. Show the kids the big pictures of the lights, show them the big seats. You're going to sit in this seat, you're going to open your mouth. So it was really fun working with this intern. We also created these sensory kits that we're trying to partner with dentists. We have 11 dentists out there testing these kits out. And what they're filled with different type of sensory items. So think of like a weighted blanket. We have a weighted elephant, I think, is in there. Fun little poppers, these cool glasses that are colorful, a blanket. And it was really tricky because we had to play the game of making it easy to clean as well as making it fun. So it was a lot of excitement this summer. And we're testing it out. We're surveying the dentist to see how it goes, which is really funny because we only gave them one set and we would like this set back, right? So imagine giving a kid a stuffed animal and then at the end of the dentist appointment asking for it back. So a few dentists have told us that they've lost a few items. So it's kind of cute. We'll see where it goes. We're hoping dentists will take the lead on it a little bit more than us. And then recently, February 1st, we partnered with Clark College Dental Hygienist Program, and throw the acronyms in the chat. I'll throw them in the chat. We'll put them in there. So the dental hygiene program, they bring in children from the community to let the hygienists work on these kids. And what Jan did is she partnered with Anna and got an extra few hours just allotted for children with special healthcare needs. So these dentists got to work with these kids and we got to test out our sensory kit, and the hygienists, they also got a 1-hour training beforehand, focusing just on how to work with kids with special needs. So it was a really big push at like the systems level. If Clark College can take it on, then it's going. It's a great program. And we're hoping to do more next year. So it's the first Saturday in February. And then this year, we're going to partner with the Emergency Preparedness Department with the Special Healthcare Needs Program. So we're kind of doing a lot of merging and try to get families more prepared for an emergency. And some of these emergencies can be like their own personal emergency, like think of a family emergency, or think of like a community emergency if something were to happen just in Clark County, or think of like what they're talking about, the big earthquake or something that happens along the whole Pacific Northwest. What can we do to help these families think one step ahead so that they're more prepared? Do they have specific medications that they only have certain days amounted? And how can they get more of the medication? Do they have specific devices that need to be charged? Can we prepare them with maybe a generator? Can we get them thinking in this direction of what does this family need if there was an emergency that's specific to this kiddo? So we're starting to work with that. We've created a flyer that we're going to get translated and get the final touches on. And then we're going to start with making little emergency kits for these families, as well as just getting the conversation rolling. So I think that's a few of ours, and I'll let Jan talk about our care mapping.
So children and youth with special health care needs has gone through a little bit of a transition a few years back. If anybody knew this program before, it was seated with a public health nurse, and she was able to go out to people's homes and do home visiting and some of the care coordination. We know care coordination is a huge topic in our community. There's not enough of it. Families with very complex medical needs, children can get overwhelmed and lost in the system a little bit. And Department of Health has recognized this need, and the monies don't grow. So they have moved from more of a one-on-one hands-on care coordination program to trying to work within the system and do more of system change work. And so when our public health nurse, Connie Callahan, I don't know if anybody knew her from back then, when she retired, I was able to apply and as a community health specialist. And it's just to get into the community, find out where the needs are and where the energy is in the community, and try to help with the system changes, utilizing that. So providers and their patients and kiddos can get into the systems without that third person. It's like it more streamline it in there. So children and youth with special health care needs, now we're promoting a system of care where children can connect to services and resources so their child can thrive in our community physically, developmentally, and emotionally well-being. To do this, some of the things that we're doing is we partnered with Washington Community for Children, and we are one of the lead promoters for Vroom. If anybody hasn't seen Vroom, it's a phone app and materials. It's free for families, and it is over 1,000 tips and tricks for brain building activities from ages 0 to 5. They're on there. You can have multiple children on there at multiple ages. They'll give you a tip a day for that child's age group, or you can go in there and there's 14 different category buckets that you can choose from of something you want to work on that day or multiple times during the day, like going to the store. What do you do with your child when you're going to the store? Instead of they want, you give them a list, you have them look at things, you have them categorize things, you teach them while you're speaking to them. It's just, it's easy, it's free, and it's pretty powerful. At the end, they give you like a little kudos of what you've helped your child learn today. How did you build their brain? How did you get them creatively thinking and problem solving and all those things? So it's a great program to dabble into if you haven't seen it. And then we also are promoting Dolly Parton's Imagination Library. We love books. We want everybody, all kids, by the time they go into school, to have their own library. And so if we can encourage families to enroll in Dolly Parton's library, they get a appropriate book a month to read to their child. And then as the child begins to read, it changes. And then by the time they're in school, they should be read ready with their own little library. So Dolly Parton Imagination Library, it's we love it. And we are trying to promote that Clark and Cowlitz counties. And then we are very excited partnering with Tanya and her staff in April to bring to our families with multiple complexities to their children care mapping workshop. A care map workshop is where you start with your child and they're in the middle of the universe, and then you slowly work out from the family and their main providers and caretakers to their network. And their network is a variety of their medical team, their school, finances, how this family and this child is supported financially, home care. Some kids need that home nurse, nighttime nurse. Social interests and activities. Who is your child? What do they like? What are their interests? We want to encourage that inclusivity in the community. So we want to include summer camps, outdoors, dancing, Legos, whatever they enjoy. To give a full picture of your child, who they are, and their journey through the medical system. So we're going to be presenting that to our families April 16th. We're really excited with Tanya and support by her staff. So for our care mapping workshop, we have it will be April 16th from 11 to 1. It will be at the Bridgeview Resource Center. We'll provide free lunch, and the event itself is free. Children are welcome. We'll have a special room for children activities and someone to watch them. And then we will help the parents walk through creating this tool to help share their child's journey with other professionals, other people involved in their child's life. It is just another way to share in 1,000 words without having to voice anything. It's can be real powerful. Registration is required though, and there is a QR code. We'll share the link, or if you're on Tanya's Informer, she has shared that already.
And if you're catching this recording on our YouTube channel, which is where it will live, you will see the registration in the comments in the description section. There you go. My words are leaving me.
So one of our last programs is Nurse Family Partnership. Jan and I both have had time in it, so it's kind of exciting for us. It's kind of where we started. And it is a home visiting program it used to be for first-time moms. Now they've changed the program requirements. It's for any parent up until before the baby is born. That's the biggest kicker, is before the baby's born. If the baby's here, we can't accept clients. But before the baby is born, call and get a referral, or go to their website, call us. That number comes to us as well. And we can get them a nurse. The best part about this is they get a nurse up until the kiddo is 2 years old, which sees them between every other week to every week, depending on where they're at in the stages. The sooner we can get them registered in the pregnancy, the better, because the nurse gets to create this relationship with them and help them with every little challenge that comes along the way between any medical things. I always think how amazing it would be to just have a nurse on call kind of situation that you touch base with once a week, of all the little things going on with the little ones. The nurses also help with, life situations and everything that comes up for our families. So it's a great program. If you know anyone who's pregnant, please refer them to NFP, another great Nurse Family Partnership, NFP, another great program. And then another program or another big project, go ahead.
I was going to say, or if you know of a nurse who would love to be part of the Nurse Family Partnership program, we have two positions available in Cowlitz County.
Yeah. So we're still trying to hire those. I believe one is part-time and one might be full-time. So if you know any nurses, great hours, a lot of fun, different type of environment. And then another project we worked on was the Raising Clark County project, where we surveyed over 600 families in Clark County to see how everybody's doing and feeling and what they're thinking and what kind of matters the most to them. And so we actually took our Chishkin families, as much as we could reach out to in Clark County, and interviewed them and said, what were their challenges and how are they working with the systems and things like that. And we have these beautiful reports that we've come up with, as well as childcare, working parents and employment. I think they're still getting out the economic security one and the access to resources. It takes a lot of people to read through these, and we read through them multiple times, and then we make beautiful artwork for them. So it's a slow process, but we're getting there. So if you want to read them, we're going to post the links in the chat as well.
And that is public health in a nutshell. So thank you. Are there any questions on that? Anything that you heard or that you did not hear and you were curious about?
And I can stop the recording too, if that makes it easier. Thank you so much for being here.